LifePoint's Healthy Lung Program is a lung cancer program that's really targeted towards finding lung cancer and making sure that it's getting taken care of. When I started in 2016, one of the things that I noticed pretty quickly was that we weren't doing a lot of lung cancer screening in our hospitals. We did some investigation and looked at how do we do this better? How do we bring these programs into our hospitals? What are the challenges that keep our hospitals from adopting this service? It really was that it was very burdensome for staff and they needed some technology to support them. And so that's when we started looking to see what type of technologies were out there and what were the best ones. We landed on a great technology and then we started intentionally putting that program into all of our hospitals.
I vividly remember the first discussion that we had about this little company called Eon. And I remember discussing the potential impact that this technology could have. That of the thousands of scans that are happening inside of our organization, to take that scan, move it over to the side, and search for something that the physician may not even be looking for initially. And then to be able to reroute that back to the patient through their primary care provider to identify something that needs to be taken care of.
I'm involved in the community health assessment, and during that we were talking about the strengths of our community, and one of those strengths was our low-dose CT. It just so happened with that community health assessment, I asked Dr. Carpenter if she would be my doctor because I have no health issues. I'd be a really easy patient for her.
The initial with most preventative and annual exams is to go through risk factors, and Teresa said it best, she's very healthy. She didn't have a lot to really talk about that day. So we have radiologists that are looking at these low-dose lung cancer screenings and says, okay, this is a new nodule, we need to do a close follow-up. And so it only grew just a little bit, but it changed shape. And that was the key to say, okay, we gotta do more now.
The biopsy came back as adenocarcinoma. If they didn't advocate for preventative medicine, it would have been caught late. And the majority of the time, it's caught in stage 3 and 4 metastasized. If I had not have had the care team that I had, I wouldn't have had this outcome.